Hello, good morning, everyone. This is Dr. Khan. I have a wonderful patient. She is 8 hours away from me. And so she is now literally post-op day number 1, to be exact, almost 24 hours from her surgery. Now she had basically 425 overfilled saline implants below the muscle. Now let me ask you a question. How do you feel right now overall?
I feel lighter. I can already tell my brain fog has gotten so much better. My hands and feet were always cold. I had a lot of hypothyroid symptoms, and I can already tell it's actually going away.
Sure. And, you know, again, this is way too early. As a physician, as an MD, I'm going to say, you know, it is, you know, you obviously have taken the Percocet. You know, there's so many other effects right now. So, you know, we will take this, you know, very seriously, but at the same time, keeping into account 24 hours into your surgery, how you're feeling. You know, the one thing you mentioned that you're breathing better too, with all that weight taken off your chest. Physically, mechanically, I can only imagine if you have like 2 sandbags, you know, compressing your chest, you can only imagine how much more difficult that is, especially up the... Now, how was your anesthesia experience?
Awesome. She was really, really kind. I had no problems with any of it. Waking up was great.
Sure. Now, let me ask you a question. How do you feel you look when you just saw the results? I had the entire dressing down, and how do you feel like you look?
I cannot believe that I didn't need a lift, and that I don't have any drains or anything. I'm really happy with how I look, even just a day after surgery.
Yes, yes. And so we will continue to hear from you. We'll continue to get the feedback. And again, the emphasis point here is for the many other plastic surgeons all over the world, that this surgery absolutely can safely be done without the need for drains and without the need for a lift in someone young and healthy, and in the many patients who do not need it. I would estimate, roughly speaking, 80%. And it can safely be done with twilight anesthesia without the need for general anesthesia as well, with the risks that come with general. With the twilight, you're in comfortable and safe zone as well. Now, how was your research getting to me? What led you to me?
I was trying to figure out if I needed to get new implants or if I wanted to take them out. And so I started Googling, basically looking around, and then I looked on Facebook. And that was when I found your Facebook page. I was really new to the whole concept of just straight explant. But then I started watching videos and learning more about it, and seeing some of the videos that you had posted from the OR really is what made me realize this is gross. I don't want new ones put in. I don't want any of that in. And so that put me on a really fast track to try to get in here. That was about 2 months ago. All
right. Now, sounds great. Thank you again very much for sharing your journey. Again, it's very important. Do your research. Listen to your heart. Talk to other plastic surgeons. If you talk to 10 others, you will likely get 10 different answers. And so very important to do your research, be informed, get the informed consent, and be content about your decision.
Sure.
Right. Yeah, you're welcome. And, you know, one last thing I will mention, you know, once you get done with the surgery, you want to be at peace. You want to have that comfort. You have to have that peace of mind that your surgery was done in exactly the same manner as was discussed, without any variations, changes in the OR, because that's what your surgeon firmly believes from his or her own heart, that this is the best surgery, where the goal of the surgery is only one: remove the implant capsule as one system, as 100% total capsulectomy, the 100-100-0 rule. 100% of the time, 100% of the capsule must be removed with 0% remaining behind, and that you have no burden remaining behind, and you got the best surgery ever, without any doubt. Take care. Thank you very much. Have a safe trip back.